Our next guest, Colin Campbell, who was the Jacob Gould Schumann Professor Emeritus of Nutrition, Biochemistry, Cornell University, author of The China Study, Startling Implications for Diet, Weight Loss, and Long-Term Health Care. Colin Campbell was trained at Cornell University and MIT in nutrition, biochemistry, toxicology, spending 10 years on the faculty of Virginia Tech's Department of Biochemistry and Nutrition before returning to the Division of Nutritional Sciences at Cornell in 1975. His principal scientific interest, which began with his graduate training in the late 1950s, has been on the effects of the nutritional status on long-term health, particularly on the causation of cancer. And in fact, his book, The China Study, is the largest study of diet and health ever conducted. What percentage of disease, the fatal degenerative disease, would you say would be caused by meat and dairy in this country in terms of our general overall healthcare populations? What are meat and dairy doing? What are they costing?
Yeah, well, the way I like to say it is that if we consume the right kinds of foods, we can actually prevent, in my estimation, at least 90% of those serious diseases. I mean, that's a big number, and maybe more. Who knows? But, in addition to being able to prevent those diseases, if we do it right, now we know that the same kind of diet actually can be used to treat people who already have been diagnosed with these diseases. So it's more than prevention. It's actually treatment, too. And I find that whole concept to be extremely exciting because that's been the territory, if you will, of modern medicine. And here we can use diet to do these remarkable things. To prevent and treat. Yes, prevent and treat. I know my physician colleagues don't like to hear that all that much, but since the book came out, I've been around lecturing a lot and gained a lot of physician friends, too. Along the way, I, of course, had physician colleagues and friends before that, and I've spoken at a lot of medical conferences, and I'm hearing more and more from medically trained people, clinical people, that when they try this, on their patients, they were getting remarkable results. And that's a story yet to be told, and I think it's perhaps the most important part of the story of all. Because, as you know, people... if you just tell them, if they eat this or that, they won't get such and such a disease in the future, well, it's not a very hard sell. I mean, people kind of postpone those ideas. But if you tell them that already after they have the condition, that it'll help to solve their problem, that's pretty amazing. What sorts of conditions are you to which... I'm talking about heart disease. That's a winner. That's been demonstrated very clearly by Dr. Esselstyn, and, of course, a little bit earlier in a smaller study by Dr. Ornish and some others. And then also diabetes, type 2 diabetes. Dr. John McDougall and a number of other clinician friends of mine have done that. And that happens very fast. I mean, they put these people on the right kind of diet, and the diet is so powerful, the thing that they have to worry about is, making sure that they reduce their insulin dose fast enough, because otherwise they go into hypoglycemic shock. Wow. But even things like multiple sclerosis, a really serious kind of disease that progresses, and we know of a major study that's been carried on for 4 decades, I think. And Dr. Roy Swank started that many years ago and made a comment after 34 years that he was able to prevent the progression of 95% of the people who are diagnosed with multiple sclerosis with this kind of diet. Wow. I mean, that's a staggering figure. It is. But, if you translate it into dollars, I mean, you're talking about 90% of serious disease, 90% of trillions of dollars? I mean, is that our healthcare plan right there? That sounds like a wild idea, but really, I believe it's going to take in a lot of compliance. So they say people are going to have to do it the right way to see those kind of returns, and we'll never expect to see, numbers quite like that, but we can really make a big dent, in the healthcare costs in this country if just simply people were informed. And that's the part of the story that I find really quite frustrating, to be honest about it. The government, I'm not saying, and I think those of us in the business are not advocating any kind of, arm twisting, say the population is what they ought to be doing, but what the government needs to do, and they shouldn't be doing that, but what the government needs to do is simply make sure that the public is informed, of the information that is now available. And instead, I'm finding, and I had a lot of experience with, as I say, these government agencies that worked on national policy. Unfortunately, they're too much influenced by the corporate sector, by the food and drug companies. And so they're not actually putting out the information they have a responsibility to put out. And I find that really troubling. My own research was funded by the American taxpayer almost entirely for most of the time I was had an experimental laboratory going. And so I think that the people who pay the taxes in order to do this research deserve to have a right to know what we did with their money. And so I'm kind of an outspoken critic, I guess, of the government, if you will, but not in the sense that, I'm for the government, imposing all kinds of regulations and things like that.
However, I'd be for banning meat and dairy myself. I'm all for that.
You might, in theory, it might work, but or you can say that, but that'd be a tough one to do.
Okay, well then people have to at least have the information to know how dangerous it is.
If they have the information, they'll decide for themselves, I think, and really go there. That's my experience.
Right, and so why are meat and dairy so dangerous? Why are they so connected to cancer? Why? Well,
it really has to do with their, as I say, their nutrient composition. It's the kind of nutrients they have present, the profile of nutrients. And meat and dairy, for example, animal-based foods, they don't have any of the extraordinary amount and number of the complex carbohydrates. That's what fiber falls into. They don't have really, and to speak of, they don't have any of the really significant antioxidants, which can be measured in the thousands. I mean, there's two classes of nutrients, if you will, or food components that really play a major role in preventing cancer. Of course, as I said before, treating these advanced diseases as well. And also at the same time, animal-based foods, of course, have the wrong kind of protein. That was the subject of most of my career. Protein from the animal sources tends to create problems in the body, like creating what we call metabolic acidosis, which tends to have a rippling effect and causing all kinds of adverse effects on various, causing diseases, if you will. So animal foods have the wrong kind of protein. They don't have the good stuff, like all the complex carbohydrates and antioxidants, and oftentimes they have too much fat, wrong kind of fat on top of it.
You've said the dairy protein is the carcinogen to which Americans are most exposed, right?
Yes. If people, we have a program. The government has run a program for many years, rather expensive program, to determine which kind of chemicals cause cancer and which ones don't. And if we subject dairy protein to that kind of test, and that's what we did. We did it in great depth for many years and published a lot of this information. It turns out that milk protein, the main protein of cow's milk, is the most relevant and significant chemical carcinogen we consume. Wow.
Pretty amazing. I bet you didn't grow up thinking you'd be a vegan in your lifetime.
No, I was raised on a dairy farm, as you know, Bob, and I went away to school believing that was the best way to go, and started out my research career, in fact, focused on the idea that we ought to be telling people to consume more animal-based food, especially dairy. And so I spent my early years sort of with that notion in mind and teaching courses with that same sort of idea in mind. But it wasn't long until I started seeing some things that I found rather disquieting, and that didn't support what I thought I knew.
And so now your message is go vegan.
Absolutely.